postpartum hemorrhage. Heavy bleeding after giving birth is called postpartum hemorrhage. It affects up to 5% of women who give birth. It's most likely to happen the first 24 hours after delivery. But it can happen anytime within the first 12 weeks after your baby is born. Postpartum hemorrhage is serious. It can cause a big drop in your blood pressure. If the pressure gets too low, your organs won't get enough blood. This is shock, and it can cause death. That's why it's important to get medical help right away. Every year about 14 million women around the world suffer from postpartum hemorrhage. This severe bleeding after birth is the largest direct cause of maternal deaths. In addition to the suffering and loss of women's lives, when women die in childbirth, their babies also face a much greater risk of dying within 1 month compared to babies whose mothers survive. To prevent postpartum hemorrhage, you can increase your iron intake to prevent anemia and other complications. Having healthy levels of iron during your pregnancy is important for preventing anemia and maintaining a healthy pregnancy. Maintain a healthy weight. Obesity is one of the biggest risks for postpartum hemorrhage, so it's important to maintain a healthy weight throughout your pregnancy. Although you need to gain some weight to ensure that your baby develops healthily, it's important that you don't gain too much weight. Your doctor will tell you how much weight you should expect to gain over the course of your pregnancy. If you are obese and trying to get pregnant, it's a good idea to lose weight before conceiving so that you have a healthier birth. Talk to your healthcare provider to discuss what's best for you. Get screened for anemia to prevent postpartum hemorrhage. Diagnosing and treating anemia early in your pregnancy can prevent the risk of low birth weight, premature birth, and maternal mortality. Visit your doctor to get screened for the condition, which can be treated simply with iron and vitamin supplements. Tell your doctor if you have experienced any symptoms of anemia, such as weakness, fatigue, chest pain, shortness of breath, pale skin, lips, and nails, an irregular heartbeat, cold extremities. After giving birth, observe the flow of your blood and tell your doctor or call 911 if you have any of these symptoms or signs. Bright red bleeding beyond the 3rd day after birth. Blood clots bigger than a plum. Bleeding that soaks more than 1 sanitary pad an hour and doesn't slow down or stop. Blurred vision. Chills. Clammy skin. Rapid heartbeat. Dizziness. Weakness. Nausea. Faint feeling. What causes it? Certain things can raise your chance of postpartum hemorrhage. You're at higher risk if you've had it before. For unknown reasons. Asian and Hispanic women are more likely to have it. The most common cause of postpartum hemorrhage is something called uterine atony. Normally, the uterus squeezes after delivery to stop bleeding where the placenta was. The placenta is an organ that grows in your uterus during pregnancy and nourishes your baby. With uterine atony, the uterus doesn't contract as well as it should. This can cause heavy bleeding after you give birth. You may be more likely to have this if you give birth to more than one child at a time. Twins, for example, have a baby bigger than 8 pounds 13 ounces, are in labor for a long time, have given birth several times before. Other conditions can raise your risk for postpartum hemorrhage. These include uterine rupture, when the uterus tears during labor. Cesarean section, your risk for postpartum hemorrhage is higher compared with the vaginal delivery. Tears in the vagina or cervix during delivery. General anesthesia, this may be used if you have a cesarean section. Oxytocin, Pitocin, a medicine that makes you go into labor. Preeclampsia, high blood pressure and protein in your urine that develops during pregnancy. Obesity. Issues that affect the placenta. How it's treated. There are many different treatments for postpartum hemorrhage. The cause of your bleeding will help your doctor decide what may be best for you. They could give you medicine to help your uterus contract, massage your uterus, remove pieces of the placenta still in the uterus, perform laparotomy, surgery to open your abdomen to find out the cause of bleeding and stop it, give you a blood transfusion. Blood is given to you through a tube that goes in a vein to help replace blood you've lost. Perform a hysterectomy, surgical removal of the uterus. Give you a shot of a special medicine to stop the bleeding. Have a radiologist do what's called a uterine artery embolization, which limits blood flow to your uterus. Use something called a Bakri balloon that's inflated inside your uterus and adds pressure to help slow the bleeding. Having healthy levels of iron during your pregnancy is important for preventing anemia and maintaining a healthy pregnancy. Ask your doctor if iron supplements are right for you and follow their recommended dose exactly. You can also add iron-rich foods to your diet during your pregnancy to stay healthy. Increase your intake of iron-rich foods like leafy green vegetables, beans, red meat, poultry, pork, and peas. Only take iron supplements with your doctor's approval, as a surplus of iron can cause liver damage and other health problems. Get folic acid through diet or supplements for a healthier pregnancy. Folic acid is an important vitamin that can help prevent birth defects, lowered red blood cell counts, and anemia. Ask your doctor about taking folic acid supplements during your pregnancy. In addition, eat foods that are rich in folic acid like legumes, leafy vegetables, melons, bananas. Take B12 supplements for a healthy red blood cell count during pregnancy. Getting a healthy level of vitamin B12 can prevent a lowered red blood cell count and reduce your risk of anemia. Always take good care when you are pregnant. Thank you for watching. I hope this information helps you a lot. Have a nice day.